I'm Noor Alwash. I'm a consultant dermatologist at East Sussex Healthcare NHS Trust. And in my private life, I'm a wife and a mother of three young children. I developed an interest in dermatology since I was a fifth year medical student when I did my dermatology rotation. I found and I still find it fascinating how we can actually see the results of our treatment on our patients when we see them on the second or the third follow-up visits, because the skin is right in front of us all the time. It's the first thing we see when we look at ourselves in the mirror. It's the first thing that people around us see. And when we see our patients for skin conditions, whether eczema, psoriasis, or vitiligo, they're not just affected by the symptoms of that condition. Actually, this condition affects them mentally, can affect their social life and their work. And when we help and manage this condition, we don't only treat the symptoms, we also help the other aspects of their lives that's affected by this condition, whether it's mentally or social life or work. And I find this the most rewarding thing that we can get from our work. So it's a great specialty. So me of my patients, I think I am the person who I am now because of them, and what I've learned from them and by working with them over the last 15 years or more. And what they value about me, I think, is that I always listen to them. So I try to ask my patients what is bothering them the most, what are their concerns, and I try to explain always a diagnosis to them and explain all of the available management options, if we obviously have more than one option, and try to encourage them to be part of the decision-making process when it comes to management plan. So I always hear them saying, well, you are the doctor, you are the boss, you tell us what is the best. But I always reply, actually, you are the boss. We are all here to help you. So I try to encourage them to be part of any management plan that we make, because I find by that, this will help them to understand and to adhere more to the management plan and get best results. It's more of a practice that I always like to follow. Two of them, actually. The first one is always look at the whole patient. So when I examine a patient for a mole, I can't ignore a rash elsewhere. Or if I'm examining a patient for eczema or psoriasis, I can't ignore a mole or any other findings on examination. So always try to examine the whole skin, regardless of why the patient was referred to us. It can be challenging sometimes with the very limited appointment time, with the busy clinics, but I think it is a very important practice to follow. And the other thing is that always try and when I see any patients for the first time is to go from the beginning, start with a fresh pair of eyes, go through the history, the examination again, all of the investigations, because in dermatology, we often see patients who have been seen before and given previous diagnosis maybe years ago. So it's important to always start from the beginning, make the diagnosis and formulate the plan.